layman, they read a lot of disclaimers on the vials and media, and like you said, WhatsApp University saying consult your doctor before you take the vaccine. And there's so many conjectures regarding the side effects. I'm going to split my question into two. Are there any contraindications to taking the vaccine today?
Yeah, so the contraindications right now are quite rare. I mean, like a contraindication would be like, we are not currently licensed to give Covaxin to a HIV infected individual or an immunocompromised individual. So these decisions Bharat Biotech cannot make. These are decisions that the primary healthcare, the doctor has to make. So Pragya, if you have a patient and they come to you and say, and if you have an immunocompromised patient post-surgery or whatever, it is the doctor who has to make that call in the best judgment of the patient. What we know is that the vaccine is safe. We've done extensive trials in 30,000 people. We've rolled out the vaccine to approximately 20 million people in India. So we're gathering all of that data. But again, when you come to these special populations of HIV infected people or immunocompromised people or people who are on chemotherapy, it gets very nuanced, and it's very difficult for us to do these many clinical trials in such a short interval to give you our recommendation. But this is where I think the ultimate authority should be the doctor.
So ultimately, though, for example, cancer patients and those with ischemic heart disease or any such comorbidities will have to speak to their doctors before taking the vaccine. The other question is, we know that every vaccine comes with side effects. They can be minimal and they can be to a certain extent, but it's ultimately an inactivated vaccine that's entering your body. And there's so much media hype about these side effects, and people are, well, at least a couple of months ago, they were extremely nervous to take the vaccine. What are your comments on the side effects and why people should not be afraid to take a vaccine?
Sure. So that's a fantastic question. Even if, hypothetical scenario, if I take the purest form of water, put it in a syringe and inject it into someone's muscle, there will still be a side effect. That is how the body reacts to anything that it thinks is foreign. Anything that's foreign, your body reacts. It's a natural phenomenon. In fact, it's good if your body is reacting to it, because that's how your body should be. That's how your immune system should function. That's what causes a process called inflammation. Your body is on red alert and it's ready to detect and fight whatever that foreign substance is. So as mentioned to you in the first part of my talk, that's exactly what a vaccine does. It is a completely foreign entity. It does not belong. It is not part of your body. Once injected, your body detects it, and then it starts going into work mode, starts to detect the virus, starts to mount an antibody response. And when all of these good things are happening, when your body is actually functioning, doing what it's supposed to be doing, there are other kinds of reactions that occurs when your body is operating at such a level. It could be fever, it could be a rash, it could be swelling at the site of injection, it could be generalized weakness. If all of these are mild or at least self-limiting, and if all of these occur at such a low rate, like 1 in 10 or 1 in 20, it's acceptable for a vaccine to be injected into you. That's usually what we do. We study this extensively. I told you 30,000 people have been vaccinated in our clinical trials. This is the essence. Every trial is always looking at safety. You can't ignore safety. So this is what we do. This is what every vaccine manufacturer does. So as long as the risks, which are your side effects, are extremely low and the benefits are extremely high, which is the benefits here are protection from you either getting mild COVID disease or severe COVID disease, or even succumbing to the infection. So it's always a risk-benefit analysis, and that balance always has to be tilted towards the benefit. And if it's always the case, a vaccine gets licensed.
Your phase 1 data did show good safety results as well, right? And it also does not mean that if you do not have any of these side effects, it does not mean that the vaccine is not working, because that was a commonly asked question as well. So, any precautions after taking the vaccine, Regis, with regards to your daily activities, like exercise or diet, and some people smoke, consume alcohol. Any precautions before and
Yes,
after?
absolutely. So I think it's quite important for you to be in a healthy state before and after you take the vaccine. As I mentioned to you before, you're going to get injected with something foreign. You want your body to be operating at a good level. Um, I've read papers that exercise does help your immune response. So I can't really explain what is the causal link between good exercise and a good immune response, but I do know it decreases stress. So try to exercise to whatever extent you can, not go hardcore. Just a mild, moderate exercise is what I suggest before and possibly after. Good sleep. Sleep is quite important. You don't want to be stressed out when you're getting a vaccine. And also probably refrain from alcohol or tobacco consumption for maybe 2 days before and 2 days after, just to make sure you're operating at a good level and you feel all right, you feel healthy, and you go in for your jab.
And I would like to add good hydration as well at this point in time. So,
Absolutely.
my next question, Regis, is what is herd immunity?
Yeah, so herd immunity is a topic that's also been circulating around. I studied this in my epidemiology textbooks, and I was quite surprised in the beginning of pandemic. Everyone seems to be talking about it. Herd immunity is, for example, you take a room of 10 people, and say Pragya and Rachis are vaccinated. And when we go into that room of 10 people, because we're vaccinated, we potentially don't have the virus. So, in thereby, you're giving some indirect protection to those other 10 people around you. So, that's what herd immunity does. But herd immunity is only effective when you have a certain amount of people vaccinated. You need to have a minimum of between 60 to 70%. There's no real hardcore number on that, but you need to have a good amount of the population vaccinated to be herd immune. And I'll tell you why herd immunity is important. There's going to be cases where you can't give vaccines to certain individuals. Pragya can probably elaborate on this much better. Severely immunocompromised people or people who are really terminally ill. You can probably range more examples, Pragya. But there are indications where you can't give it. You can't give it to, maybe if Covaxin is licensed in 2 to 18-year-olds, it's not going to be licensed from newborn to 2-year-olds. So those individuals, those babies, infants, can't be vaccinated. Severely ill, terminally ill patients cannot get vaccinated. So at least if you're vaccinated, you probably won't be, there's a good probability that you won't have the virus in you, that you're protected. And thereby, if you interact with such and such individuals, you won't transmit the virus to them. So it's indirect protection given towards people who are not vaccinated. That's what herd immunity is.
At this point in time, how long do you think it would take for us to achieve herd immunity via vaccination?
So that's a tough call. I mean, you could get herd immunity from either natural infection or vaccines, but what we've been seeing is that natural infection is probably not the best approach to use. You can't just say, oh, the second wave has gone through India, so maybe we don't need to get vaccinated. No, I think it needs to still revolve around vaccinations, and vaccinations will still continue to be the key for us, at least for the next year.
Right. So the other common question that comes to me is, Regis, that, for example, this healthy person XY has taken Covaxin, like the first dose of Covaxin around 2 months ago, and they've gotten the second shot after 28 days. But obviously, with the current wave and the changing variants, if they have access to any other kind of vaccines, can they take it? What are combination vaccines, and can we mix these vaccines?
So right now in India, we don't have any data to indicate to the public that it's okay changing up vaccines. I would not advise it right now because we don't have data. Science is completely evidence-based research. They are doing similar studies like this in the UK, where they're giving you a Pfizer vaccine and then they're giving you a AstraZeneca vaccine with the second dose, or they're mixing it up. They're giving you first the AstraZeneca vaccine, followed by the Pfizer vaccine. That data is extremely preliminary right now. We're hearing that It's still causing some amount of side effects. We don't know how well the immune response is. But for the time being, my recommendation is not to mix and match. This is not a buffet, strictly a set menu.
Just take the vaccine that you get and make sure you're strong immunity wise. So Rachel, also intranasal vaccines, you're coming up with that and studies are going on at the moment. Comments on that?
Very preliminary again. I don't want to make comments of a project that is ongoing here at Bharat. However, our belief is that an intranasal vaccine, so the advantages with an intranasal vaccine is that, of course, it's like a spray that goes into your nose and it stays in your upper respiratory tract. And what that does essentially is that it tells your immune system here in your nose to generate an antibody response. And these antibodies are called local antibodies. So they reside only in your nose. And the scientific understanding behind this is that if you have antibodies in your nose, when the virus enters, it's going to get killed immediately. So it's not going to get a chance to go downstairs, which is to your lungs, and cause pneumonia-like symptoms or cause respiratory complications. So if you can kill the virus here, prevent it from going downstairs, you've solved the problem. You will probably prevent disease. You will probably prevent infection. And if you prevent infection, if you stop it here, you'll prevent transmission as well. So that's the golden triad of a vaccine. That's the holy grail. If you're able to stop disease, infection, and transmission, you've hit the jackpot. That's what we're trying to do. We have good, strong animal data, which were done by the Washington University in US that suggest that we're on the right track. However, human data also needs to corroborate that. And that's still ongoing.
Right. So just to underline, I heard this interview by Dr. Krishna Ella a couple of weeks ago, where he clearly explained that the vaccines that we have today only protect you from lung down. And the intranasal vaccines are the ones that will protect you whenever they do come out. So obviously it is extremely important. We shouldn't be under the misconception that we will be protected and we should not be wearing the mask and following the regular COVID protocol. So am I right in saying that vaccines do not protect you completely?
You're absolutely right. Vaccines don't protect you completely, but it's important to get a majority of the population vaccinated in this country. And I believe that's what we're all working towards. But no vaccine is 100% efficacious. So the best way to combine that is with your continued mask and social distancing and other COVID-19 appropriate behavior.